Hello everybody and welcome to my channel. I'm Mariah. Today's topic is ADHD or Attention Deficit Hyperactive Disorder. In this video I will cover what ADHD is, symptoms, types, ADD versus ADHD, adult ADHD, ADHD and children, causes, ADHD testing, treatment, medication for ADHD, natural remedies, and more. This video is research based. For the research in this video, I read 2 different articles for this topic, but I used only one article to gather information. I will include both articles in the video description box in case anyone wants to read them. Everything you need to know about ADHD, and that's the first. That's the only article that I actually included in this video. It's from the Healthline website. What is ADHD? Attention Deficit Hyperactivity Disorder, or ADHD, is a mental health disorder that can cause above normal levels of hyperactive and impulsive behavior. People with ADHD may have trouble focusing their attention on a single task or sitting still for long periods of time. Both adults and children can have ADHD. It's a diagnosis that the American Psychiatrist Association, or APA, recognizes. ADHD symptoms: a wide range of behaviors associated with ADHD. Some of the most common ones include having trouble focusing or concentrating on tasks, being forgetful about completing tasks, being easily distracted, having difficulty sitting still, and interrupting people while they're talking. If you or your child has ADHD, you may have some or all of these symptoms. The symptoms you have depend on the type of ADHD you have. Types of ADHD. To make ADHD diagnosis more consistent, the APA has grouped the condition into 3 categories or types. The types are predominantly inattentive, predominantly hyperactive - impulsive, and a combination of both. And this is the first type, predominantly inattentive type. As the name suggests, people with this type of ADHD have extreme difficulty focusing, finishing tasks, and following instructions. Experts also think that many children with the inattentive type of ADHD may not receive a proper diagnosis because they don't tend to disturb the classroom. This type is most common amongst girls with ADHD. Predominantly hyperactive impulsive type. People with this type of ADHD show primarily hyperactive and impulsive behavior. This can include fidgeting, interrupting people while they're talking, and not being able to wait their turn. Although inattentive is less of a concern with this type of ADHD, people with predominantly hyperactive impulsive ADHD may still find it difficult to focus on tasks. Combined hyperactive, impulsive, and inattentive type. This is the most common type of ADHD. People with this combined type of ADHD display both inattentive and hyperactive symptoms. These include an inability to pay attention, tendency towards impulsivity, and above normal levels of activity and energy. The type of ADHD you or your child has will determine how it is treated. The type you have can change over time, so your treatment may change too. ADD versus ADHD. You may have heard the terms ADD and ADHD and wondered the difference between them. ADD, or Attention Deficit Disorder, is an outdated term. It was previously used to determine to describe people with problems who have problems paying attention but are not hyperactive. This type of ADHD is called predominantly inactive, which is used in place of ADD. ADHD is the current overarching name of the condition. The term ADHD became official in May of 2013 when the APA released the Diagnosis and Statistical Manual of Mental Disorders, the 5th edition, or DSM-5. This manual is what doctors refer to when making diagnoses for mental health conditions. Adult ADHD. More than 60% of children with ADHD still exhibit symptoms as adults, but for many people, ADHD symptoms decrease or become less frequent as they get older. That said, treatment is important. Untreated ADHD in adults can have a negative impact on many aspects of life. Symptoms such as trouble managing time, forgetfulness, and impatience can cause problems at work, home, and in all types of relationships. ADHD in children. 1 in 10 children between the ages of 5 and 17 receive an ADHD diagnosis, making this one of the most common childhood neurodevelopmental disorders in the United States. For children, ADHD is generally associated with problems at school. Children with ADHD often have trouble succeeding in a controlled classroom setting. Boys are more than twice as likely as girls to receive an ADHD diagnosis. This may be because boys tend to exhibit hallmark symptoms of hyperactivity. Although some girls with ADHD may have the classic symptoms of hyperactivity, many don't. In many cases, girls with ADHD may daydream frequently and be hyper-talkative rather than hyperactive. Many symptoms of ADHD can be typical childhood behaviors, so it can be hard to know what's ADHD related and what's not. What causes ADHD? Despite how common ADHD is, children and researchers still are not sure what causes the condition. It's believed that it's believed to have neurological origins. Genetics may also play a role. Research suggests that a reduction in dopamine is a factor in ADHD. Dopamine is a chemical in the brain that helps move signals from one nerve to another. It plays a role in triggering emotional responses and movements. Other research suggests a structural difference in the brain. Findings indicate that people with ADHD have less gray matter volume. Gray matter includes the brain areas that help with speech, self-control, decision-making, and muscle control. Researchers are still studying potential causes of ADHD, such as smoking during pregnancy. ADHD testing and diagnosis. There's no single test that can tell you if you or your child has ADHD. A recent study highlighted the benefits of a new test to diagnose adult ADHD, but many clinicians believe that an ADHD diagnosis cannot be found based on one test. To make a diagnosis, your doctor will assess any symptoms you or your child has had over the previous 6 months. Your doctor will likely gather information from teachers or family members and may use checklists and rating scales to review symptoms. They'll also do a physical exam to check for other health problems. If you suspect you or your child has ADHD, talk to your doctor about getting an evaluation for your child. You can also talk to their school counselor. Schools regularly access children for problems that may be affecting their educational performance. For the assessment, provide your doctor or counselor with notes and observations about you or your child's behavior. If you suspect ADHD, if they suspect ADHD, they may refer you or your child to an ADHD specialist. Depending on the diagnosis, they may also suggest making an appointment with a psychiatrist or neurologist. ADHD treatment. Treatment for ADHD typically includes behavioral therapies, medication, or both. Types of treatment include psychotherapy or talk therapy. With talk therapy, you or your child will discuss how ADHD affects your life and ways to help you manage it. Another therapy type is behavioral therapy. This therapy can help you or your child with learning how to monitor and manage your behavior. Medication can also be very helpful when living with ADHD. ADHD medications are designed to affect brain chemicals in a way that enables you to better control your impulses and actions. ADHD medications. The two main types of medications used to treat ADHD are stimulants and non-stimulants. Central nervous system, or CNS stimulants, are the most common prescribed ADHD medications. These drugs work by increasing the amount of brain chemicals dopamine and norepinephrine. I'm sorry if I said that wrong. Examples of these drugs include Ritalin and Adderall. If stimulants don't work well for you or your child, or if they cause troublesome side effects, your doctor may suggest a non-stimulant medication. Certain non-stimulant medications work by increasing levels of norepinephrine, I think, in the brain. I'm sorry if that's wrong. These medications include Strattera or some antidepressants such as Wellbutrin. And sorry if I said that wrong, but I tried. ADHD medication can have many benefits as well as side effects. Natural medication for ADHD. In addition to or instead of medication, several remedies have been suggested to improve ADHD symptoms. For starters, following a healthy lifestyle may help you and your child manage ADHD symptoms. The Center of Disease Control and Prevention, or CDC, recommends the following. Eat a healthy, balanced diet. Get at least 60 minutes of physical activity per day. Get plenty of sleep. Limit daily screen time from phones, computers, and TVs. Studies have shown that yoga, tai chi, and spending time outdoors can help calm overactive minds and ease ADHD symptoms. Mindful meditation is another option. Research in adults and teens has shown meditation to have positive effects on attention and thought processes as well as on anxiety and depression. Avoid certain allergens and food additives are also potential ways to help reduce ADHD symptoms. Is ADHD a disability? While ADHD is a neurodevelopmental disorder, it is not considered a learning disability. However, ADHD symptoms can make it harder for you to learn, as also it is possible for ADHD to occur in some individuals who also have learning disabilities. To help alleviate an impact of learning for children, teachers can map out individual guidelines for a student with ADHD. This may include allowing extra time for assignments and tests or developing a personal reward system. Although it is not technically a disability, ADHD can have lifelong effects. ADHD and depression. If you or your child has ADHD, you are more likely to have depression as well. In fact, the rate of major depression in children with ADHD is more than 5 times higher than children without it. Up to 31% of adults up to 31% of adults ADHD ADHD has found to also have depression. This may feel like an unfair double whammy, but know that treatments are available for both conditions. The treatments often overlap. Talk therapy can help treat both conditions. Also, certain antidepressants such as Wellbutrin can sometimes help ease ADHD symptoms. Of course, having ADHD does not guarantee you'll have depression, but it is important to know it's a possibility. Tips for coping with ADHD. If you or your child has ADHD, a consistent schedule with structure and regular expectations may be helpful. For adults, using lists, keeping a calendar, and setting reminders are good ways to help get and stay organized. For children, it is helpful to focus on writing down homework assignments and keeping everyday items such as toys and backpacks in assigned spots. Learning more about the disorder in general can also help you learn how to manage it. Organizations like Children and Adults with Attention Deficit Disorder or Attention Deficit Disorder Association provide tips for management as well as the latest research. Your doctor can provide more guidance in ways to manage your ADHD symptoms. Outlook. For children and adults, untreated ADHD can have a severe impact on your life. It can affect your work, school, and relationships. Treatment is important to lessen the effects of the condition, but it is still important to keep in mind that many people with ADHD can enjoy fulfilling and successful life. Some even trot the benefits of the condition. If you think you or your child have ADHD, the first step should be to be talking to your doctor. They can help determine if ADHD is a factor for you or your child. Your doctor can help you create a treatment plan to help you manage your symptoms and live well with ADHD. I hope that you enjoyed this video. As always, I am open to any suggestions you have for any future video topics. Please let me know what they are in the comment section below or on my Twitter page. My Twitter page handle is @BurleyMariah. I'll spell it for you at BurleyMariah, which is my last name then my first name. The next topic is going to be on Learning Disability Awareness Week, which is actually on I think it starts June the 14th, if I'm not wrong. I hope that everyone's continuing to stay safe. I want you to know that I'm praying for you, your families, and the world. I'll post my notes in the comment section for anyone who needs them. Please like, share, and subscribe if you want to and found this video to be helpful. Feel free to share this video with anyone you think might need it. If you want to be notified for when I do any live streams or upload any new content, you're going to want to hit the bell icon. And under the bell icon, you're going to want to select the all option. Thank you for watching. I love you guys. Bye!